The Jefferson Regional Medical Center Injury Report.
Today, we're going to talk about an injury like the one that Charlie Batch sustained in last week's football game. The wrist is commonly injured in athletic events, and at the wrist, the most common bone that is broken in sporting events is the scaphoid bone. There are several different ways of treating these injuries. One way would be to merely put the person in a cast, and frequently we do this if the fracture is not displaced or remains well aligned. If a fracture, however, is displaced or out of position, we frequently try to do something to put it back into position, and that usually requires surgery. The goal of treatment of any of these injuries is to restore normal anatomy and to allow the patient or athlete to return to function as quickly as possible. After surgery is done, we typically try to rehabilitate them as quickly as possible, encouraging movement of the shoulder, elbow, and fingers initially, and once the wrist starts showing signs of healing, asking them to start moving the wrist.